Hi, everybody. I'm Sara El-Sayed. I'm one of the physicians at McLaren Family Medicine Clinic. It's in Flint, and I'm here today to talk about cervical cancer screening, ways to decrease the chances of getting that and detecting it early. So just to start, wanted to say it looks like cancer in general has made its mark on our lives, almost each one of us, whether it's personal or close people around us, but we've encountered this in our day-to-day life, and this doesn't have to happen. There are ways to decrease this, there are ways to make sure that we can prevent it, and I'm very grateful and privileged to be here today so that we can actually do something and discuss ways in which we can decrease the chances of us and our loved ones encountering this problem. January is cervical cancer awareness month, so I think this is a perfect timing to discuss this topic. I have this information prepared along with Dr. Saleh from our Family Medicine Residency Clinic, prepared to help you guys understand a little bit more about cervical cancer prevention and how to protect yourself. So just to start talking about cervical cancer, what is cervical cancer and where is the cervix anatomically? Typically, the cervix is a structure that is found at the lower part of the uterus where women typically get pregnant. And cancer in that area arises in the cells, and it could happen kind of commonly. It's the fourth most common cause of cancer in women. 1 in 3 cancers ever diagnosed could typically be prevented by early screening, and this is what we're here for. So how common is cervical cancer? How big of a problem is this? Usually around 14,000 people in the United States are diagnosed with cervical cancer every year. Usually the age that we typically find this is between 35 to 44 years of age. And around 4,000 people die every year with cancer of the cervix. And that's quite a big number for a cancer that could be very easily detected and prevented. This rate is on decline because we're seeing a lot of people get screened more and get their vaccines, and we're going to talk about this in just a few minutes. But I wanted to take a moment and talk about some alarming numbers that we've been coming across in terms of the amount of people diagnosed with cervical cancer and the amount of people who die with cervical cancer. What we're seeing and finding is that people, Hispanic women and Black women have the highest rates of being diagnosed with cervical cancer. But we're also seeing that Black women are the most likely to die of cervical cancer, which is quite alarming. And this does not have to happen. If we have better screening and we could do better with screening and vaccines, we should see an improvement in this number. Why does this typically happen? Where some of the proposed reasons is that decreased rates of screening or test result communications in that group of people. It could be also genetic factors, being more likely to be diagnosed with this cancer than other counterparts, or being diagnosed or found later in later stages of life. What kind of treatments are offered, all of those impact the numbers that we're seeing in terms of people dying and being diagnosed with cervical cancer. Same goes along the vaccination lines. We are seeing improved vaccine rates for HPV amongst all groups, but we are seeing that Black people and Hispanic people are less likely to get their vaccination rates completed for HPV than their other counterparts. What are the risk factors to get diagnosed with cancer of the cervix? There are quite a few risk factors. Some of them we can control and some of them we can't. The most common ones that are known are getting diagnosed with an infection that is called HPV, having multiple sexual partners, as in 2 or more partners in the lifetime, being a smoker, having had 3 children or more, having a poor immunity system or what we call immunocompromised, using birth control pills for a long time, and lifestyle factors like eating less fruits and vegetables, or if it runs in your family. Any of those risk factors would predispose you to getting cervical cancer. We're going to talk about a couple of them just to make sure that we understand why it predisposes people to cervical cancer. And the most important thing would be the human papillomavirus, or what we call the HPV virus. Now, just an understanding of what is causing cervical cancer, what we're finding is 99.7% of people diagnosed with cervical cancer, we find that virus in them, which it means that if this factor is prevented, a lot of cervical cancer is going to be prevented from developing. What is that virus? It's a viral infection that could be transmitted via sexual contact, whether vaginal or oral or anal. It could happen, there are different types of the virus. Some of them cause cancer, some of them cause warts. In most of us, the good news is our immune system can clear it out and it goes away and it doesn't cause any problems. And our immune system prevents the harm that could be done. But there is some people that this infection just persists for a long time, and over time it could predispose them into turning into cancer. So how do you know if you have cervical cancer? The problem with this kind of cancer is that most of the time people don't feel or see anything. In advanced cases, women might notice they have vaginal bleeding or watery discharge or foul discharge, but unfortunately most people don't have any symptoms. So the next question is, if you can't see symptoms, how would you prevent it from happening? And I would say it's going to be one of the three things: preventing your risk factors, getting your vaccine, and getting screened. So getting screened every 3 to 5 years, make sure you prevent risk factors like smoking, limiting your number of sexual partners, using condoms to prevent catching the infection. And one of the most important things is get the shots or the vaccines to prevent you from catching the virus to start with. Now, the HPV vaccine, it does show promising numbers. 88% of people who got the vaccine did not get HPV. We saw a reduction of around 40% of cancers caused by the HPV virus in vaccinated women. So looking at just raw numbers, people who got the vaccine, 36,000 cases of cancer in men and women in the United States. Out of them, 33,000 could be prevented if people get their HPV vaccines. Now, who exactly is eligible? Anyone between the age of 9 to 26 should be getting the vaccine, whether men or women. It would be best and ideal to get it before the age of 11 or before any sexual encounters have begun, to just increase the chances of protection. But even if that happens and people started sexual activity, they can still get the vaccine. Not as effective, but it still does have some protection. Now, is it safe? And that's the most common question we get in our clinic. Yes, this vaccine has been on the market for more than 15 years with ongoing research. There are more than 135 million doses distributed in the United States, and bottom line is, so far, no serious side effects have been encountered. The most common side effects are soreness in the injection site, local symptoms like kind of irritation and pain, but no major side effects. It does not cause fertility problems, and that's something that a lot of people kind of like ask about because they hear it a lot, but that has never been found in studies. It does provide long-lasting protection. Something people should know is some people, when they get the shot, might be prone to having a fainting episode 15 minutes after the vaccine, and that does not have any like serious consequences. It's a side effect of the vaccine that could happen with also other vaccines other than HPV. Things that we typically hear, or questions that we typically hear, that HPV virus infections are not that common, which is not true. We've seen that more than 80% of Americans are going to be exposed to this virus at some point of their life, which is a huge number. The HPV only causes cervical cancer? No. We see that the HPV virus causes mouth cancer, throat cancer, anal cancer, cancer of the penis, cancer of the cervix, and the vaginal area. So it's known to cause different kinds of cancer, and it happens in both men and women. The vaccine isn't that effective. Again, just looking at the numbers, and the drop of around 88% in the number of people being infected with HPV is very impressive in the vaccine effectiveness. That vaccine is not just for women, it's for both men and women, because both can catch and transmit the infection. You should only get it if you're sexually active. Also not true. You want to protect yourself regardless of your sexual activity or even if you're monogamous for one partner for your entire life. Next is your PAPS or cervical cancer screening. You want to check for that cancer before it actually happens or it becomes late in the stage of cancer. You get PAP tests at your doctor's office. They also test you for the HPV virus during that test. What they typically do in the PAP test is try to get some samples of the cells of the cervix to see if they've turned into cancer and catch it early on when it's easier to treat. Those tests typically happen every 3 to 5 years, depending on whether you get only the cell test or you get the HPV test with it. Then you get it every 5 years. So it's once every 5 years. It's not that we don't do it that frequently. So it gives some women some peace of mind that they don't have to go through the pelvic exams that frequently. What does a PAP test look like? Women typically have pelvic exams. They go to their doctor. They're asked to undress from the waist down. Doctor uses something like a speculum shown in this picture to look at their cervix, get some samples of the cells, and get a swab for the virus. One of the things you want to make sure you do before you go is make sure you're not on your period. You don't use tampons or have sex for 48 hours before. Nothing in that area, whether it's washing, douching, or using any birth control foam or gel, because it could affect your PAP results, so make sure you keep that in mind. A lot of women, especially in our community, have been through sexual assaults or violence, and PAPs are not easy for them, and they might trigger unpleasant experiences from before. So I just want to make sure that know that you need to discuss this with your doctor. Find a doctor, ask them if they have experience with patients who have been victims of sexual trauma in the past. Tell them what triggers you, what are the words that could be triggering, what are considered safe words for you so that your doctor can accommodate. Have a family member in the room if that makes you feel better. There's always going to be a chaperone in the room as a nurse or a medical assistant. Know that you can walk out at any point of time. Make sure you ask all the questions you need. Tell your doctor to talk you through the procedure if that's going to make you feel safer. All of those are things that you know that you could do to make yourself feel protected and safe when you're getting your pelvic exams done. Anyone who's over the age of 21 is typically who we screen with PAPs. Anyone below that, regardless of whether or not they started their sexual activity, we don't screen because your body gets rid of the HPV virus infections very easily during that age. And beyond 65 is when we typically stop the screening tests if everything has looked good over the years. Now, this doesn't apply for everyone, of course, but typically, general rule 65 and above, if everything has looked good throughout their life and they've had regular screenings, this is when we stop screening them for cervical cancer because of their chances are much less at that time to die from and to get diagnosed with cervical cancer. PAPs, get that done even if you've had the HPV vaccine, even if you're not currently sexually active. Get your PAP done even if you've had the same sexual partners for a very long time. If you're gay, lesbian, bisexual, or transgender, you still need your PAP done as long as you have a cervix. If you're pregnant, you still need your PAPs. And if you've been through menopause, you still need your PAPs. And even if you feel like you have no symptoms, because we've discussed before that cervical cancer a lot of the times does not present with any symptoms. After you get your test done at the doctor's office, you should expect a phone call with the results within 1 to 2 weeks. If it takes longer than that, make sure to give them a call. Find out your results. Never assume that the results are normal because you didn't get a phone call. Sometimes things are missed this way and you don't want your result to be positive and no one knows about it. The doctor is going to tell you if your result is normal or abnormal, or sometimes we call it unclear. If you got an HPV test, we're going to tell you if it's negative or positive. Abnormal tests don't mean you have the cancer. It just means that the cells don't look like the normal ones we know, and we need to look into it further. And follow-up is very important. Well, what does it mean if I have an abnormal result or I have an unclear result? It means that the doctor is going to bring you back, do more testing, look with magnifying lens at your cervix, and make sure they look into that abnormal result. Is it cancer? Is it precancer? They might need to take biopsies and send them and verify what they're seeing. This is just what it means at this point. Well, if they do a biopsy and it tests positive, depending on how abnormal or positive it is, they should be able to remove most of the abnormal cancer cells with procedures that could be done under general anesthesia or just local numbing in the office, depending on how advanced your case is. And if it's actual, true, full-blown cancer, in this situation, your doctor is going to discuss things like scans and trying to find out if it spread or didn't spread. And there are options like chemotherapy and radiation and surgery that could be offered, as well as care that makes you more comfortable during that journey of chemotherapy and radiotherapy. So this is what your results typically mean when you get a Pap test. What can you do? You can protect your family, make sure that your kids get the vaccine. If they're anything above age of 9, whether they're a boy or a girl, make sure you get your vaccine and tell them to get the vaccine. It's safe, it's effective. Teach your children the names of private parts. We found that children who are unashamed of naming their genitals and their private parts, they're more likely to speak up if they're experienced any sexual abuse. If you're uncomfortable, you can leave sex out of the conversation when you're talking to your children about HPV vaccines, or you can talk to your pediatrician or family physician to help you navigate difficult topics with your family and with your children. And always make sure you make sex education part of family conversations. Prevention is key and protection is key. Just wanted to leave this here for everybody. If you can't afford a Pap test, or you can't afford a vaccine, or you don't have an insurance, there are so many ways around this. There's a national breast and cervical cancer early detection program, so all the states have free screenings, and insurance reimburses or pays for those tests. You can go to your health department for vaccines. You can go to your clinic and ask them if they take people without insurance and they're covered. There are free clinics all over Michigan. We have one in Genesee County that can help get your Pap done free of charge. So just know that, and also same applies for the HPV vaccine. Those are common reasons that we see for people not being able to access care to get screened for cervical cancer: transportation issues, cost issues, not liking their doctors, or being too busy. People who think that because they're not having sex right now, their chances are less, no childcare. Those are common things that we see. There are other things out there, and there's always something that your physician's office can provide. We can refer you to resources where they can help with transportation and covering transportation issues. There are some physician's office that have areas that your children can wait at and have some books and things to entertain them. So discuss it with your providers and local clinics. There might be a lot of solutions for things that get in the way for you to get screened. Bottom line is, this does not have to happen. Cervical cancer is a very preventable cancer. It's easy to detect it early before it spreads and causes problems. What can you do? Get your vaccines, get your loved ones vaccinated, get screened with your Pap, have safe sex practices, don't smoke, pick a healthier lifestyle choice always when you're picking food and exercise. This is going to decrease your chances for all kinds of cancer, not just cervical cancer. And this is the end of my presentation. If anyone has any comments or questions, concerns. Those are my references. Thank you for listening.